This is the To Health With That Naturally Healthy in No Time podcast for big health topics taken in small bites. I'm your host, naturopathic Dr. Amy Newsel, and this is Season 1, all about the MTHFR mutation. This week, we're going to talk about who should care about the MTHFR mutation because the short answer is not everybody. On the internets, it seems like everyone cares about MTHFR right now, but honestly, it isn't necessarily important for everybody. Not even for everybody who has a known mutation. Just having a polymorphism is not a cause for panic. Having an MTHFR mutation, even one that's considered significant, will never have any symptoms, signs, or health risks for some people. Just having the gene doesn't mean anything in terms of supplements you should take, things you should do, or really anything else. In fact, over-supplementing can be as harmful to your health as under-supplementing. There are two main factors that make MTHFR matter. One is your circumstances, and the other is your symptoms. So let's review what MTHFR might do, and then we'll talk a little bit more about what I mean by circumstances and symptoms. You'll remember last week we talked about possible health consequences of the MTHFR mutation, and there's several categories of those. One is midline abnormalities, things like neural tube defects, cleft lip, cleft palate. Cancers is another big category. Cardiac disease is a big category. Especially related to clotting disorders and high homocysteine levels. Fertility issues, neurological issues are a problem, mood and psychological issues, including anxiety, depression, obsessive-compulsive traits, things like that, and then also abnormal reactions to medications and therapies. So with those big categories in mind, when should people actually be concerned? Well, this is simple. Here are the circumstances that matter. Number 1, by far, fertility and pregnancy. If you suspect that you or your partner might have an MTHFR issue and you're considering having a baby, it matters to know what your status is so that you can get your health right before you build a baby. Because a lot of the long-term consequences of MTHFR issues happen in that embryonic stage when the baby is developing. And so we really want that part to go well. The second circumstance is when treatments for depression and anxiety aren't working. This is a really strong indicator that there's something underlying the issue that isn't being addressed. And none of the medications out there really manage MTHFR issues. They just manage the symptoms of MTHFR issues. So sometimes getting underneath those symptoms can really help. The third circumstance is if you have a strong family history of early cardiac death. It may or may not be related to MTHFR, but if it is, then knowing your status gives you something you can actually work on instead of just waiting for the axe to fall. And the fourth circumstance is if you happen to have 3 known bad copies of MTHFR. This is 3 compromised copies of significant SNPs, C677T and A1298C. Remember that there's only 4 copies, so if 3 of them are compromised, that probably means you should address it. So those are the circumstances in which MTHFR really matters and in which you should actually care and try to address it. But the other circumstance is if you're having a number of symptoms related to MTHFR. So if you or your genetically related family members have more than 3 of the following list, then your life might actually get significantly better by addressing your methylation status, whether you know about your MTHFR or not. And again, this is independent of testing. You don't have to test your MTHFR to work on your methylation status. So again, more than 3 of these: anxiety, overachieving tendencies, perfectionism, obsessive thoughts, insomnia, cleft lip or cleft palate, spina bifida, abnormal or unexplained clotting, bad reactions to birth control pills, alcohol intolerance, schizophrenia, bipolar, repeat miscarriages, unexplained low sperm count, Alzheimer's dementia, and that would probably be a family history, addictions, high homocysteine levels, food or chemical sensitivities, intense competitive drive, serum folic acid tests abnormally high or abnormally low, if new car smell gives you a headache or other symptoms, or if taking B vitamins sometimes makes you feel depressed. Now, that seems like a really random list, but those are all things that can be highly related to methylation issues. And so if you or a direct genetic family member is having a number of those symptoms, not just one, because lots of people are perfectionist or have insomnia or, something like anxiety or depression. But if you or a direct genetic family member is having 3 or more of those, then it's important to think about your methylation. So, just important as who should be worried is who should not be worried. And actually, there's a fair list of those people. One is people who have no bad copies and know they have no bad copies. This does not concern you. You don't need to spend the time. People who know they have one bad copy but don't actually have related symptoms or family histories. You're doing great. Your diet and lifestyle are keeping up with your methylation just fine. You don't need to do anything at all. And also people who don't know their genetic profile, who also don't have related symptoms or family histories. Yeah, you're doing good. Don't worry about it. So hopefully this will narrow the field a little bit and give you some idea about whether or not this is something that you need to spend your time on. Because managing MTHFR and methylation cycle can be a lot of effort. So next week, we'll talk about why methylation matters so much, especially in regards to genetic expression. It matters for other reasons, too, like hormone balance and detoxification, but we'll get on into those down the road. Thanks so much for listening today, and visit tohealthwiththat.com if you'd like to see a written version of this podcast, because that was a lot of symptoms to think about. Have a great day.